Namaste. I am delighted to be here with you all for this event to deliberate on the importance of equitable, accessible, and quality healthcare service. India has always prioritized universal health coverage through various national programs. However, to provide momentum to the agenda, Honorable Prime Minister Modi ji launched the path-breaking initiative of Ayushman Bharat with its four associated pillars. Under the Ayushman Bharat Health and Wellness Center, access to quality primary healthcare services is being strengthened through establishment of 1,50,000 health and wellness center to provide preventive, promotive, curative, rehabilitative, and palliative care. Second pillar of Prime Minister Jan Arogya Yojana provides health assurance to 500 million citizens for identified secondary and tertiary healthcare services free of cost in a cashless and paperless manner, making it the biggest government-funded health insurance scheme of the world. Through Ayushman Bharat Health Infrastructure Mission, an outlay of 641.8 billion has been sanctioned to strengthen surveillance, create a network of integrated labs, infectious disease hospitals, and research network to aid ongoing COVID-19 response and manage future health emergencies. Fourth pillar of Ayushman Bharat Digital Mission seamlessly interviews these initiatives to create continuity of care and is working towards establishment of a digital health ecosystem. While the catastrophic nature of COVID-19 has been evident globally, it also highlighted the need for investment in healthcare system. India firmly believes in technology as a great enabler in healthcare services delivery and strengthening the pandemic response. Aligned with our data-driven and digital-first approach, we deployed cutting-edge intervention, leveraging quick, contactless, and innovative technologies to increase penetration of specialty health services and bridge the digital divide. We ensured that all relevant data is consolidated in a common framework through COVID-19 portal with data from 730 plus districts. Further, we have tracked more than 918 million tests conducted in the country on a real-time basis through ICMR's RT-PCR portal. India also launched eSanjeevani platform, world's largest telemedicine network, ensuring free of cost online health services to citizens, and so far more than 100 million teleconsultations have been conducted. Under the visionary leadership of Honorable Prime Minister, vaccine management platform CoWIN was developed in record time and has been the backbone of the nationwide vaccination campaign with more than 2.2 billion doses administered so far. We also exported over 290 million vaccine doses to the world under Vaccine Maitri initiative. The government took decisive steps which culminated in effective management of COVID-19, where India's cases per million population of 32,786 and deaths per million population of 389 are significantly lower than the global average of 87,236 and 872 respectively. While on one hand we work towards saving precious lives, we also put equal emphasis on minimizing the adverse economic impact of the pandemic. India's COVID 19 management efforts have been lauded globally, and I'm happy to share that I recently inaugurated a report published by Stanford US Asia Technology Management Center, which has estimated the economic impact of India's key response strategies. The reports highlighted that India was able to save more than 3.4 million lives by undertaking the vaccination campaign, which yielded a positive economic impact of $18.3 billion, with the schemes launched to support medium and small scale enterprises, an economic impact of $100.26 billion has been noted, which is around 4.90% of the GDP. Similarly, under the Pradhan Mantri Garib Kalyan Anna Yojana, we distributed free food grants to 800 million people, which resulted in a positive economic impact of 26.24 billion US dollar. PM Garib Kalyan Rozgar Abhiyan provided immediate employment and livelihood opportunities to 4 million migrant workers, which resulted in an economic impact of 4.81 billion US dollar. While the global economy was severely impacted, India managed to sustain the economic growth and is poised to growth at a rapid pace. India aims to be the voice of Global South under its G20 presidency and is bringing together multiple stakeholders with action-oriented and impactful measures. We are espousing enhanced collaboration and investment in research and development of medical countermeasures and focus on strengthening manufacturing capabilities. We believe in distributed manufacturing of vaccines, drugs, and therapeutics with an emphasis on accessibility and affordability to ensure equitable healthcare. India is proposing a global medical countermeasures platform with focus on diversified manufacturing through regional networks to increase accessibility globally. We are also furthering the agenda of digital health during our G20 presidency with a focus on launching the global initiative on digital health. As an institutional frameworks, we are building consensus on digital public goods to address challenges in universalization of digital health. India has already provided COVID, e-Sanjeevani and Arogya Setu applications as a digital public good to interested countries around the world. This demonstrates our commitment to global health and our role in driving innovation and equitable access to critical health solutions. It has become glaringly obvious that this pandemic will not be the last the world faces. We have learned the preparedness cost only a fraction exponential of its impact, but the returns on this investment are exponential. We need more coordinated and effective global efforts to drive greater alignment and actions on key health, economics, and finance policy levers through knowledge sharing, technology transfer, and collaborative manufacturing. India leading the G20 agenda has opened avenues to revive, rebuild, and strengthen global health partnerships under the tenets of One Earth, One Family, and One Future. We believe that it is essential to adopt a inclusive approach aligned with the principle of Vasudhaiva Kutumbakam to ensure that every individual has access to quality health care. Thank you.